A 13-year-old boy came to my orthodontic practice looking like this. This was his face, his smile, again his smile in detail, and here is a frontal view of his occlusion. The panoramic radiograph revealed the problem. A supernumerary tooth, looking a lot like a lateral incisor, is present into the occlusion. You see it here in yellow color in the pan, and another supernumerary tooth which remains embedded into the bone of the upper jaw, and you see it here in purple color. These two supernumerary teeth have blocked and fully stopped the eruption of the normal upper right permanent central incisor. Evidently, in order to correct this serious problem, we have to remove these two supernumerary teeth. The one that is visible into the oral cavity can be easily extracted, but the second supernumerary tooth must be extracted surgically. After that, we have to orthodontically provide enough space for the impacted upper right central incisor. Then, in a second surgical procedure, we will expose it and pull it into the dental arch to its physiological position. These are the initial photos obtained at the day we initiated treatment. You see the right side view of the patient's occlusal, you see the frontal view, as we have already seen, and here you see the left side view. Now you see the occlusal view of the upper dental arch. We see there is some crowding present here, and spaces need to be gained, like I said. And now we see the occlusal view of the patient's lower dental arch. There is a moderate crowding there as well. So then I referred the patient to the oral surgeon to have the supernumerary teeth extracted, as well as the remaining upper right primary canine. And here you can see the supernumerary teeth that have created most of this orthodontic problem. The parents of the patient brought them to me. As soon as these above teeth were extracted, I placed fixed appliances on the upper dental arch and started to create space for the impacted upper right central incisor. I proceeded with leveling and alignment of the upper dental arch. I placed an open coil spring to gain space at the area that will be later filled by the impacted and exposed upper incisor. After a couple of months, enough space was gained, as you see in these following pictures, and it was time to expose the impacted upper incisor. Here are a few photos of the exposure procedure. You can see the surgically exposed upper incisor and an eruption chain that was bonded to its labial surface. And then that chain was gently tied by means of elastic thread to the main arch wire. You may also notice that a pontic, a fake upper central incisor, was placed on the upper arch wire a few weeks before the exposure just for aesthetic purposes. I will now stop this presentation just to ask you one question. Which, to your opinion, is the best rock and roll band ever? I don't know. Think about it, and I will give you my opinion at the end of this interesting orthodontic presentation. So here we have fixed appliance on the upper dental arch, pulling the impacted tooth into it. Now you see the impacted incisor is visible into the oral cavity. In this process, I am gradually grinding away parts of the pontic, this fake tooth, in order to let the central incisor fit. And here the once impacted upper incisor is almost into its final position. It was now time to bond braces in the lower dental arch. And here we are very close to concluding with the orthodontic treatment. And these here are the photographs that I took when all braces were removed. I am happy to see that the midlines are well aligned. The patient has a nice class 1 canine and molar relationship on both sides, right side, left side, and the initial deep bite is corrected. Though I am quite unhappy that the gum line of this exposed central incisor is visibly high. I am considering of making a video clip discussing this phenomenon that sometimes occur when impacted teeth are exposed from the labial and not from the palatal side of a patient. This happened even if I've moved slowly and cautiously, applying only gentle extrusive forces by means of elastic threads and elastic arch wires, as you have seen in the previous pictures. On the other hand, a teenager can endure only so much orthodontic treatment. He was, as patients usually are, very keen to get rid of the braces and move on with his life, which is perfectly understandable. I referred him to a specialist periodontist to see if gum plastic surgery can help with that problem. The treatment started February 2016 and it was finished June 2018. That's about 2 years and a half. All things considered, I'm quite pleased with the result, as was the patient and his parents. He now has a nice healthy tooth in his mouth, although he needs to improve his oral hygiene standards. I am quite pleased with this result, and I have to reveal the answer to my question. The best rock and roll band ever is Dr. Feelgood, and I'm talking about the initial lineup with Lee Brillo on vocals and harmonica, Wilco Johnson on the guitar, John B. Sparks on bass, and John Big Figure Martin on the drums. Best rock and roll band ever, and the best albums that you should, young people, check out are these three: Down by the Jetty, Malpractice, and Stupidity. And behind me is a beautiful Fender Telecaster custom shop. Bye-bye.